my name is Callie. I'm going to be a nurse today, okay? Could you please give me your name and your date of birth? I verify that. I would also check and make sure that this patient also has an order for a catheter, okay? Is there any allergies that I should be aware of? Are you allergic to iodine, anything like that? No? Perfect, okay. Is there anything culturally that I need to be aware of? Okay, all right. So the first thing that I'm going to do is I'll provide privacy. I'm going to go ahead and get my gloves on. I'm going to put a bath towel over you because I'm going to have to expose your lower body, okay? But I'll keep this towel over your upper body, try to keep you warm. And also, I'm going to do some peri-care before I get started. Okay. So I'm just going to be inserting a catheter for you. It should only take about 10 minutes, okay? Should not be very long. Okay. I'm going to pull this blanket down. Okay. Right. Okay. I'm going to get my rag. Okay. Just going to clean it up a little bit. Alright. Okay. So now that's done, I'm going to go ahead and get started. Okay, so I'm going to verify, I'm going to make sure that this is the right type and size of catheter. I'm also going to make sure that the date is still good, which it is. Okay. So I'm going to go ahead, get this ready. I'm going to have you put your legs out from me if you can, this far. Oh. Okay. All right. Open my package. Okay. Right. I'm not going to be using the drapes. So I'll just set those out of my way. Okay. And also I have my own gloves. So I'm going to go ahead and get my sterile gloves. Hopefully you can see that. Alright, I'm going to get my right hand first. Pull this cuff down. Okay. Alright, so first thing, I would technically have to have iodine, but I don't in this kit. But I would get my iodine, I would open that, and I would put it all over my cotton balls. Get that all ready. Okay, and then what I'm gonna do is I'm gonna open my lubricant. Just rip that off. Okay. And then ahead, I'm gonna get my water. I'm gonna connect it here. I'm gonna try to get some of that. Okay, connect that. Alright, I'm gonna go ahead and get this off. I'm gonna just set it in my lubricant. Right in there. Okay, I'll leave that right there. Alright, so I'm gonna pull this forward a little bit. Okay, so now I'm gonna get my cotton balls and with the iodine on them. I'm just gonna sanitize the patient. Okay, do 1, do 2, 3. Alright, so now we're done with that. Okay, so now I'm just gonna kind of swap these places. Move that forward more. Perfect. Okay. So now I'm gonna take this hand, okay? I'm gonna hold the labia. Okay, I'll get my catheter out. Maybe. Probably should have done that first. Okay. Alright, so I'm gonna insert it. You ready? 1, 2, 3. Insert it. I'm gonna be inserting it until I get urine return. Once I get urine return, I would insert it another 1 to 2 inches. Okay, so now that I'm holding it, I'm gonna take my hand. I'm gonna insert the water into the balloon. Alright, make sure that that is secure. I'm gonna go ahead and get that off. Okay. So now that that's done, I'm gonna go ahead and remove these gloves just because I have lubricant all over them. Okay. I have a trash can right here. I'm not sure if you can see that. Okay. And then go ahead and get another pair of gloves on. Now what I'm gonna do is I'm gonna secure the catheter to the patient's leg. Get another one of those. Alright. So I would secure it to the patient's leg, snap it on there. I grab the bag. Make sure the valve is closed because that tends to happen a lot, and then there's urine everywhere all over the floor. Okay. Then I'd hang it off the side of the bed. Okay. Maybe. Got it. Alright, and then I'm also going to clean the patient up. Okay. Pick my area up. I'm gonna have to keep that though. Discard this. Alright, and that is it. So then I would cover the patient back up, get the blankets back up on the patient, make sure the patient has everything they need. They have their call light in reach, like nothing's in the way of like from the door to them. Their bed's in the lowest position. And then I would document that the insertion of the catheter, how like the patient handled it, the size and type of catheter. If there was any urine return, I could document that, or if maybe it was for if they needed a UA, I could document that I sent the UA out. And then that would be it. And then for catheter removal, I'd come in the patient's room, get them uncovered, explain what I'm doing, verify the patient, verify the order for the removal, provide privacy, would remove the, I don't remember what they're called. I would unsecure this from the patient's leg. Okay, then I'd get this inserted in there. Okay, get the water out maybe if it decides not to go out on me. Get the water out. Make sure I get it all. Okay. I'm gonna remove your catheter now. You ready? Okay, I want you to exhale. 1, 2, 3. Okay, pull it, pull it, pull it. Get it in this towel. I check the end of the catheter, make sure everything's good. Okay, we're done with that. All right. Oh, another thing that I would do is I would have emptied the bag before I took the catheter out. And then obviously document what that looked like and how much. And then dispose of this. Okay. And then I would also clean the patient up. Thank you so much for your time. You did great. I could cover the patient back up. Oh, sorry. Get this out of their way. Okay. And then I would document that I removed the catheter. I would document like how much urine was in the bag before I emptied it, like what it looked like if it was clear, if it was dark, if it was like kind of, if there's like sediment or anything in it. I just document all that. Document how the patient handled the removal. I would document the end of the catheter. I would document what that looked like if there was something wrong with it.